Senate Committee on Health, Education, Labor, and Pensions will come to order. This morning, we will be considering 4 bipartisan health care bills. The first bill that we'll consider is the PREMIE Reauthorization Act led by Senators Bennett and Bozeman. This legislation would reauthorize $10 million over the next 5 years to conduct research and other activities that could not only lead to a reduction in preterm births, which affect over 10% of all babies born in America, but could also reduce the infant mortality rate in our country. That's that's bill number 1. Second bill is the Preventing Maternal Deaths Act, which was introduced by Senators Capito and Warnock. In 2021, the maternal mortality rate in the United States was more than 10 times the estimated rate in other developed countries. That is clearly a disgrace. Root causes of maternal mortality and make recommendations to reduce the maternal death rate in America. The next bill that we will be considering is the Gabriella Miller Kids First Research Act 2.0, which was introduced by Senators Kaine and Moran, that authorizes a total of $188.4 million over the next 10 years for critical research into pediatric cancer and structural birth defects. And let me thank Senator Kaine for his leadership on this bill, and I know how important this bill is for him and for families all over this country who are struggling with childhood cancer. The final bill that we will be considering is the Bipartisan Primary Care and Health Workforce Act that I have been working on with Senator Marshall, the ranking member of the Primary Care Subcommittee, for the past several months. And let me thank Senator Marshall and his staff for their very, very hard work on this bill, as well as a number of other senators and their staffs as well. This has been going on for several months now. I would like to say a few words about this legislation. Let us be clear, and I think we all understand this. Our current healthcare system is broken. It is broken. Despite spending almost twice as much per capita, an estimated $13,000 a year for every man, woman, and child in this country, 85 million Americans are uninsured or underinsured. Over 60,000 Americans die each year because they don't get the health care that they need. And we pay by far the highest prices in the world for prescription drugs. And amazingly, in the richest country in the history of the world, our life expectancy is lower than other countries and is actually declining today. That's what's going on in the United States. Further, this country faces a major crisis in our healthcare workforce, and that is an issue we have dealt with. We had some excellent hearings on that brought forth, some wonderful panelists from both sides. According to the American Hospital Association, not Bernie Sanders, the American Hospital Association, the United States will face a shortage of up to 124,000 physicians by the year 2033. We will need to hire 200,000 nurses a year to meet the demands of an aging society. The Association of American Colleges has said that we may lose as many as 55,000 primary care physicians by that time. In other words, and I think nobody disputes it, we have a major crisis in this country in terms of the number of doctors, nurses, dentists, and mental health professionals that we need. According to the senior contributing editor of the Kaiser Family Foundation Health News, Elizabeth Rosenthal, and I quote from a piece in the Washington Post, quote, "American physicians have been abandoning traditional primary care practice, internal and family medicine, in large numbers. Those who remain are working fewer hours, and fewer medical students are choosing a field that once attracted some of the best and brightest because of its diagnostic challenges and the emotional gratification of deep relationships with patients. Listen to this. The percentage of U.S. doctors in adult primary care has been declining for years and is now about 25%, a tipping point beyond which many Americans won't be able to find a family doctor at all. Already, more than 100 million Americans don't have usual access to primary care, a number that has nearly doubled since 2014, end of quote. And nobody thinks that the situation is not getting worse. In other words, we have a major crisis in primary health care, and it is time for us to address it. Further, the healthcare crisis we face also deals with the reality that millions of Americans are unable to get the dental care that they need. In my view, dental care is health care. According to Louisiana State University, and I quote, as many as 59 of Louisiana's 64 parishes are designated dental health professional shortage areas by the Louisiana Department of Health. More than a third of Louisiana parishes have either no dentist or can count all available providers on one hand, end quote. But clearly it is not just Louisiana. In the state of Vermont, in the southern part of my state, children, low-income children, cannot find a dentist in Bennington County. And it's not just Louisiana, it is not just Vermont, it is virtually every state in this country. This legislation, the legislation that Senator Marshall and I have introduced, does not solve by any means all of the healthcare crises that we face. In fact, it is a far more modest piece of legislation than I would have liked to have produced. But if this legislation is passed, it will not only save us substantial sums of money by making our healthcare system more efficient and rational. It will not only significantly increase the number of doctors, dentists, and nurses that we desperately need, but it will go a long way toward making primary healthcare in America more affordable and accessible for millions of Americans. This legislation increases mandatory funding for federally qualified health centers from $4 billion a year to $5.8 billion a year for 3 years, which will enable more Americans to receive not only high-quality primary health care, but dental care, mental health counseling, and low-cost prescription drugs. That is what community health centers do, and they do well, and they do it in a very cost-effective manner. In addition, this bill includes a one-time allocation of $3 billion to be used to establish dental operatories so the community health centers can expand their dental care capabilities. In addition, it will allow community health centers to build more space for mental health counselors, something they desperately need. Let me be clear. This legislation will save substantial sums of money. Investing in primary health care will keep people healthier and out of hospitals. Investing in community health centers will keep people out of emergency rooms, which cost 10 times more than going into a community health center. There is a reason why most other major countries spend twice as much as we do on primary health care and end up spending far, far less per capita on health care. They invest in keeping people healthy and out of hospitals, and that makes sense to me. To quote a senior member of this committee, and Benjamin Franklin as well, quote, "An ounce of prevention is worth more than a pound of cure," end of quote. That is precisely what this legislation intends to do. In fact, according to the director of the Center for Health Policy Research at George Washington University, the funding that we have included in this bill for community health centers alone will save the federal government over $40 billion over the next 3 years, far more than this bill cost. Further, this legislation triples funding for the National Health Service Corps from $310 million to $950 million for the next 3 years. As everyone here knows, the National Health Service Corps provides student debt forgiveness and scholarships to doctors, dentists, and other medical professionals who practice in underserved areas. We need to get health professionals into rural areas. I have heard this time and time and time again, in underserved areas, and that is what expanding the National Health Service Corps can do. This legislation more than doubles funding for teaching health centers, going from $126 million a year to $300 million a year for the next 5 years. Teaching health centers are extraordinarily important because they allow medical school graduates to do their residencies in community health centers and small rural hospitals instead of just large teaching hospitals that are in urban centers. And if we want more doctors and dentists and nurses to practice in rural areas and underserved areas, this is an important way to do it. We have also included $300 million in our bill, which will go to those medical schools that focus on growing the number of graduates practicing primary care. As I indicated earlier, this legislation will greatly increase the number of nurses in America by addressing the shortages of nurse educators in our country, another major issue. Is this a perfect piece of legislation? No, I don't think so. I've not seen too many perfect pieces of legislation come before the Congress. And I am sure that members in a few minutes will be telling us why they are opposed to it. In fact, my understanding is that Senator Cassidy will give us 67 reasons in his amendments as to why he opposes this bill. But let me conclude by saying this. Everybody here knows we have a crisis. It is very easy to be critical. I don't have a perfect piece of bill. Senator Marshall doesn't. But you know and I know that when you go home, your constituents are going to tell you, hey, I can't find a doctor. My kid can't find a, we can't find a dentist. Your CEOs in the hospitals are going to tell you, we're spending a fortune on traveling nurses. And then your nursing school is going to tell you they don't have the faculty to educate the young applicants who want to become nurses. Everybody agrees with that. So I would hope that at the end of the day, every one of us can go home to our districts, our states, and say, you know what, ain't a perfect bill, but we have made progress in addressing a major healthcare crisis in America. And with that, I yield to Senator Cassidy for his opening remarks.
Thank you, Chairman Sanders. You know, we can agree with the diagnosis and disagree with the prescription because I accept everything you said about the crisis in healthcare. The Obamacare expansion of Medicaid has been unsuccessful at expanding access to primary care. Dental services are paid for by Medicaid for the poor, but they're paid so poorly that dentists cannot keep their doors open. So we can acknowledge a failure of that policy. On the other hand, it isn't important what I think about this. If we're talking about increasing the number of primary care physicians, talking about how do we better serve, talking about workforce, what is probably more important is what stakeholders say. I'll refer to this later, but let me just take an excerpt from America's Essential Hospitals. Essential Hospitals' mission means they shoulder a disproportionate share of unreimbursed care. And I can give you more. These hospitals are concerned that these experts in providing culturally competent care to their marginalized communities will be harmed by this bill. That's important. That isn't Bill Cassidy. Those are the people that are front line in addressing those who are marginalized. Now, let's talk about workforce. Here is from the American Hospital Association. Put another way, provisions in this legislation to cut hospitals and health systems are cuts to the healthcare workforce, as more than half of the hospital's expenses reimburse nurses, physicians, technicians, and other team members. Oh, that's something about the workforce provision, huh? And then let's talk about the American, let's see, what is this? The Association of American Medical Colleges. If we're doing something good for medical training, maybe the AAMC would have something to weigh in on. I write today, however, to express deep concern that counterproductive measures included in the legislation jeopardize patient access to care, etc. Now, it is important what Bill says. It's important what the people who are front line say, and they do not care for this legislation. But I will say, I care about community health centers. Since becoming ranking member, I have worked in good faith to reauthorize community health centers, the National Health Service Corps, and Teaching Health Centers Graduate Medical Education Program before they would expire, and in a way which would get broad bipartisan bicameral support, because it has to be signed into law. And for the record, Republicans care about community health centers. As the chair likes to say, President Bush pledged during his campaign to fund 1,200 new health centers. He exceeded his promise in his 8 years, working with Congress to double the size of the program with discretionary investment. The Community Health Center Fund now provides an additional mandatory funding stream to those centers, and I understand the chair's passion for the fund. He created it during the Affordable Care Act. Senate Democrats weren't ready, I'm told, to support a single payer, and so he pushed for this, the mandatory funding, and my gosh, it's a bipartisan priority. And we have reauthorized the chair's fund on a bipartisan basis 3 times. Not easy. Mandatory funding presents logistical and practical challenges, but we've always got there. But every reauthorization has been short. We always fight for longer funding cycles and for more certainty, but we can never find the money. Bipartisan offsets are scarce. Now, the biggest pot of mandatory funding that helps jurisdiction is student loans. What a lightning rod. Yeah, we're going to go after student loans in order to do this. That's not going to happen. When we did the Surprise Medical Billing Act in 2020, it was practically a miracle. We never thought we'd have that kind of mandatory funding, but that gave it to us. And we used those savings for a 3-year extension of the Community Health Center. With that context in mind, I was very open to a funding increase when the chair and I began discussing reauthorization. My goal was to reauthorize the fund on time, which Congress had failed to do in 2017 and 2019, creating uncertainty for community health centers. We need to fully offset our spending. If we're not fully offsetting our spending, we're really just putting out a press release. And we need to have comprehensive HIDE protections. Not big ask, but every single reauthorization has met those parameters. So how do we get where we are today? We're marking up a new proposal 6 legislative days before the program expires. We have no time to align with House counterparts, guaranteeing that we'll have to do a short-term, flat-funded patch. Not a good outcome for community health centers who wish to have certainty and who were scheduled to receive an increase in funding from the House bill should we have built upon that. Now, the chair first proposed increasing community health center funds by more than 500% to more than $130 billion. And he kept telling me to come closer to his $130 billion. I proposed a variety of funding increases, all of which I knew could be offset in a bipartisan basis and within HELP's jurisdiction. And every response was come up to the $130 billion. And with each response, we had new policies, pilot projects, and expansions of other workforce programs. Where we're not going forward, our deadline loomed. Ultimately, I introduced a bill that provides 2 years of increased funding for community health centers, a 5% bump, nothing to sneeze at, and a bill which mirrored that which passed the House Energy and Commerce Committee with a unanimous, every Republican, every Democrat voting for it, 49-0. Bipartisan consensus in a House which typically doesn't have consensus on what to have for lunch. We should have marked up that bill in July and built on its success. We could have used August to pre-conference Senate-adopted amendments with House counterparts and had something ready to go for the end of this month. Now we have the plan that Chair Sanders has just spoken of. But he didn't answer, and which HHS cannot answer, is how many new providers and access points will the funding that would support, that all this money that we're pumping into primary care, how many new providers and access points will this actually support? We know that states are doing their part to address health professional shortages. Does this proposal work with them or work against them? We don't know. I feel like we're doing what is so typical in Washington, D.C. We don't think through a problem, we throw money at it, and then we feel good because we've thrown money at it. And we put the press release out there, and we speak about it on the campaign trail, but we actually don't know that it's going to help. Indeed, frontline stakeholders say it's going to hurt. Would have been nice to talk to the essential hospitals first. We didn't have hearings on that. We didn't invite them to come and comment on this legislation. But all we're saying is that we're going to spend more money, and by golly, isn't that the cat's meow. By the way, the proposal is not close to being paid for. We don't have a CBO score. The chair can speak in an emphatic voice about how this is going to save money long term. CBO doesn't say that. Now, we can pretend they do, but they don't. The chair acknowledges that we have to rely upon other committees to close a multi-billion-dollar gap. And the chair says, oh, don't worry, we'll work it out. Trust me, I'll get the money. Senate Finance will contribute. I'm on Senate Finance. We've not had that discussion. I speak to other members of Senate Finance. They haven't had that discussion. We can't rely upon that. In fact, I hear from Senate Finance, they've got so many things they have to pay for, it's going to be very hard, if not impossible, to share with this committee. That has not been presented to us in that way. Now, we can find money, but it's going to take a bipartisan, bicameral effort to do so. And as other committees coming to the rescue is just, it's the checks in the mail. Now, to a certain extent, this is inside baseball. Folks back home in our respective states, if you're, I don't think we're on C-SPAN, but if you were, you're probably not following. But it's an important context. We can report anything we want to out of committee, but the requirement for attaching committee-reported bills to a government funding vehicle is extremely high. And if you haven't noticed, it's pretty hard to fund the government right now. Controversial amendments are off the table. And generally, this threshold is that chairs and ranking members for every committee of jurisdiction in the House and the Senate, plus bipartisan bicameral leadership, must sign off on authorizing bills trying to hitch a ride on a funding vehicle, including offsets. Now, you can't just go to the CBO's website and copy and paste something from someone else's legislation until you've offset. You've actually got to get that agreement. Now, other chairs have their own goals and priorities to spend the money on. What do the ranking members in the House, what do the ranking members and House chairs of the relevant committees want to do? By the way, if you're lucky enough to spend someone else's money on a goal, the goals have to be more than just meritorious. They have to be consensus-driven that a president typically pushes for in a State of the Union speech. This legislation circumvents a recent high-profile effort reflecting months of negotiation between the President and House Republicans and was broadly supported by Senate Democrats. This circumvents that debt deal. The so-called lockbox the chair creates transfers money between Treasury accounts and directs the Appropriation Committee to spend money on HELP's behalf. The spending doesn't show up on balance sheets, unlike a traditional mandatory funding stream. Now, I know Senator Braun wants this to be paid for. This isn't paid for. This is a kind of ledger domain, money laundering, if you will. It's taking money that should be discretionary and it's putting it into mandatory, contributing to our problem of mandatory spending, driving our nation's indebtedness, and Congress not taking responsibility for otherwise cutting a program or developing resources that would pay for it. And by the way, it doesn't hit the appropriators' caps, and that was the whole purpose. How do you circumvent a hard-fought battle between House Republicans and the White House in order to achieve your goals? Running over everybody else because, by golly, you're right and they're wrong. Well, that's not the way this place is supposed to work. I'm sitting next to an appropriator who has done fantastic work. She can tell you it's hard to get that consensus. This avoids the necessary effort to create it. And by the way, the beauty of this, it pretends to be paid for, but it's not. It's one of those games we play in Washington. We assume we're being fiscally responsible. We put out the press release. We make the impassioned speech. We care about the debt, but it's not paid for. And it probably won't happen. It's cynicism at its worst. I didn't vote for the Fiscal Responsibility Act, and that's what I'm describing. The chair didn't either, but it's the law. And what's the point of passing a law if all we do is navigate around it? We're $33 trillion in debt, and supposedly we're committed to addressing that. Now, if you ask me if I think the chair wants to increase health care access, I absolutely agree. He wants to increase access, and I join him in that goal. But this isn't legislating. If you want to do something for patients, then you actually do the work to find the offsets on a bipartisan, bicameral basis. Don't just say, we'll figure it out. And if you don't pay for it, then all you have is a messaging bill. That's cynical, it's manipulative. You're telling the voters you're doing something when you know at the get-go it's not going to happen. It's one of the worst things in Washington. It's why people distrust this place. The lack of commitment to deadlines, offsets, not glamorous but indispensable. The lack of commitment means that we've wasted critical time that could have been used reaching consensus on realistic funding increases for important programs. Aspirations cannot become law. To still be at this step in the legislative process on September 21st doesn't help patients. Instead, community health centers are going to be flat funded for at least several months and maybe for the next year. A failure to build and reach consensus and develop viable offsets and reach agreement across the Capitol hurts the very people the chair purports to wish to help. With that, I yield.
Thank you, Senator Cassidy. Senator Marshall is a co-author of this bill. Senator Marshall.
Well, thank you, Chairman Sanders and Ranking Member. I want to start just by thanking the staff. I've always said a doctor was no better than the nurses surrounding them, and I've never felt so dependent upon staff before than writing quality legislation, and just want to say thank you and give you the ultimate compliment that in as much as my nurses were important to my medical practices, the quality of this legislation depends upon the staff behind us, and just a sincere thanks to all those people who came here along with us to not make just a point, but to make a difference. And this legislation certainly does make a difference. Access to meaningful, affordable primary health care is truly at a crisis level. America has a crisis situation with the shortage of nurses, primary care physicians, doctors, mental health providers, dentists. But our community health centers have breathed life into this primary care crisis. We envision these community health centers to be even more than what they are today. More than a blood pressure check, more than checking your glucose, that they would meet patients where they are, that there would be behavioral health folks there ready after the doctor takes the blood pressure and says, look, your blood pressure's good, your lab work looks fine, but you're depressed. And you're a farmer in rural Kansas, and you plowed your wheat crop under. Interest rates are 9%. You're behind. You can't afford your health insurance. You can't pay your electric bill. This is where those farmers and ranchers would go, is to one of these community health centers with mental health embedded in them. The opportunity for dental, again, my own obstetrical practice, night after night in the emergency room at 3 o'clock in the morning with a pregnant patient on Medicaid, and no dentist would accept Medicaid. And as we all know, poor dentation leads to preterm labor. Look, this bill addresses, no one can deny that, it addresses the issue of nursing shortage. It actually turns it around in 3 years' time. Can you imagine being in Congress, something you could actually solve a problem in 3 years? It helps address the primary care doctor issue, as well as the dental and the behavioral health professionals. And like everybody has said, this bill's not perfect, and that's why we're here today, to transparently make a good bill better and deliver for the American people. I'm wholeheartedly committed to see this bill as fully paid for in a responsible manner. And saying that, regardless of all the financial voodoo up here, at the end of the day, this is going to save American taxpayers millions, if not billions of dollars at the end of the day. Whether it's a senior citizen by getting primary care sooner than later, that investment of a $100 visit may save a $30,000 hospital admission. Look, we have 10 million people graduating into Medicare every year now for the foreseeable future. They're going to exacerbate this primary care shortage already. Those folks need primary care. As you age, I know it's not news to anybody, but you need more health care, not less. You know, people ask me every town hall I do, how are you going to save Medicare? Look, this is one of the opportunities to help save Medicare by investing in affordable, meaningful primary care. There's lots of arguments to be made on each side of this. But at the end of the day, this is doing the right thing. I didn't come up here to sit on my hands. I think that this is a very viable solution and will give meaningful, affordable access to health care for many, many, many millions of Americans. Thank you.
Mr. Chairman,
Senator Braun.
two senators here, Senator Sanders and myself, at least since I've been here, have harped more and more about a broken healthcare system. And glad to hear that Ranking Member Cassidy acknowledges that. For far too long, we've put our head in the sand about a system that costs us so much, delivers us poor results. Some of the folks against this happen to be the corporate hospitals that I wrestled with 15 years ago in my own business that will not accept reform measures like transparency, getting rid of the barriers to entry, competition. That is a free market. Not to mention that we have to have an engaged consumer that is worried about skin in the game with their own well-being, and community health centers do that. That ounce of prevention being worth a pound to cure was the essence of how in my own business I cut costs many years ago. We still wrestle with, though, corporate hospitals, insurance that's down to maybe 3 or 4 major providers across the country, and they're generally the ones that weigh in and complain about anything that you try to do to change the status quo. I'm glad we're at least here today taking one small piece of it. When you've got practitioners that I talk to all across Indiana that are regretting that they've gone to med school, and the ones that have gotten out have to wrestle with sooner or later maybe selling their clinics to private equity or a corporate hospital chain, something has got to give. And I'm thankful that Chairman Sanders, Roger, what you've done, bringing this to the forefront, this is just the beginning. And the message to those out there, if you don't start embracing things to reform yourselves, you're going to probably see more of it, because when you operate like an unregulated utility, this is the consequence of it.
Mr. Chair.
Thank you, Mr. Chairman.
Senator Kane.
Mr. Chair, I would like to speak on the Gabriella Miller
Give
bill,
me 1 second.
but I'll
We'll
wait
get right
till
to you.
after folks
Okay,
have spoken.
let us now begin consideration of the 4 bipartisan reauthorization bills. For the awareness of all senators and staff, we intend to roll all votes until the end, and we will keep members and staff updated on the timing of votes. I would also like to ask my colleagues to limit remarks to 2 minutes, and that's something I'm going to enforce because there are a whole lot of amendments out there. So please, when you are recognized, please specify the bill and the amendment number that you are offering and speaking on. Once again, I'm going to be tough on the 2-minute limits. Let's get now to S-1573, the Preemie Reauthorization Act of 2023, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye.
Aye.
Those opposed say no. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on S-1573? If so, that concludes consideration of S-1573. Let's move to S-2415, the Preventing Maternal Deaths Reauthorization Act of 2023. Are there any members who wish to speak on S-2415? If not, that concludes consideration of S-2415. We'll now consider S-1624, the Gabriella Miller Kids First Research Act 2.0, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye.
Aye.
Those opposed, please say no. The ayes have it, and the motion is agreed to. Are there any members who wish to speak or offer an amendment to S-1624? Senator Kane.
Mr. Chair, thank you. And I'd like to call up for voting at a later time a technical amendment, Kane Amendment 1. It's an amendment that has the agreement of the chair and ranking, but for a reason that my staff understands and I don't, procedurally it could not be included in the manager's amendment. I'll describe it after I talk about the bill. To the chair and ranking, thank you for including this really important and bipartisan bill, Gabriella Miller, Research Act 2.0, in today's markup. And I want to offer some special thanks to Senator Collins, who worked with me on this bill to get it in its final language in good shape. I do want to acknowledge my co-sponsors, Senator Moran, and then the members of the committee who co-sponsored the bill, Senators Smith and Budd, Murkowski, Casey, Marshall, and Lujan, and thanks to all of you. This bill has an interesting story that was its origin. It's named in honor of a youngster named Gabriella Miller, who was a Leesburg resident who died from a rare form of brain cancer at the age of 10, shortly after I came to the Senate. Even by the age of 10, she had done some pretty remarkable things while laboring with brain cancer. She was a passionate fundraiser for cancer research and raised hundreds of thousands of dollars with her mom and dad and her brother. After her death, her mother and dad, Ellen and Mark, came into my office and they said to me, they asked me a question. And I think oftentimes our legislative work begins with a question that we don't know the answer to. They said, Senator Kaine, what percentage of cancer research at the NIH goes into pediatric cancer? And I thought about it and I said, I don't know, 15%? Less than 1%. Less than 1% of our cancer research is focused on pediatric cancer. I'm a Catholic, and we do the distinction between sins of omission and sins of commission. Well, this was sort of a sin of omission. It wasn't like the NIH wasn't caring about pediatric cancer, but it hadn't maybe focused on the need for it, and maybe there was even some sense that turned out to be inaccurate. You could do research about adult cancers and apply it to kids. We passed this bill 10 years ago. It needs to be reauthorized. And by passing the bill in a bipartisan way, we've put $100 million into pediatric cancer research. And yet still 15,000 kids die every year of cancer. And so this will reauthorize and over time allow it to increase. The technical amendment that I'll ask you to vote on just changes the title of the bill. The title of the bill referred to a pay-for that we chose not to use, and so we have to amend the title to take out the pay-for that we're not going to use. And so I'll call it up, but I appreciate everybody's help on this, and it'll do good.
Senator Kaine, thanks very much for your work on that very important bill. We will now consider S. 2840, the Bipartisan Primary Care and Health Workforce Act. And let me say that as part of an agreement that I have reached with Senator Marshall and Senator Braun, I have agreed to take out the mandatory lockbox provisions in this bill. And frankly, I am very disappointed to have to do this. In my view, these programs are vital to addressing the serious shortage of nurses and primary care doctors in America. And let me be as clear as I can be. This is not the last time this committee will attempt to address the massive shortage of doctors and nurses in America. We will be back. But in order to broaden support for this legislation, in today's markup, we're going to remove these provisions from the bill. And again, this is part of an agreement that I reached with Senator Marshall and Senator Braun. Therefore, let me finish, please. Therefore, the first four votes we will be taking on amendments to this bill are Cassidy amendments numbers 4, 5, 6, and 16. And I will now call up Cassidy amendments 4, 5, 6, and 16 in that order. We will consider each amendment individually, starting with the Cassidy amendment number 4. And Senator Cassidy, you are recognized to speak. It's number 4.
Mr. Chairman,
Yes.
if you would yield to me for just a moment, could I make a suggestion that since we have 3 bills where there appears to be no opposition, that we report those 3 bills right now? We clearly have good attendance, and it would allow us to make sure that those bills get through today.
That makes sense to me. Anybody have any objections to that? I mean, I think I have not heard any objections. Senator Kaine, you had a minor technical amendment?
I would just like to call up Kaine Amendment 1 to the Gabriella Miller bill, the technical title change, and I'd ask for a voice vote.
All those in favor, please say aye.
Aye.
All those say no. The ayes have it. Thank you, Senator Kaine. Senator Collins, do you want to make a motion then?
Yes, thank you. I move that the Help Committee approve Senate Bill 1573, Senate Bill S-2415, Senate Bill S-1624,
As amended.
as amended.
We do all collect the three together?
Yeah.
Okay,
Is everybody okay doing all three together?
Is there,
all right, we're doing all three together. Senator Marshall, do you want to?
Yeah, roll call.
Second it, okay, all right,
All three roll call. Yeah.
all right.
Yeah, we have to do a roll call.
We're doing a voice,
We have to do a roll call, but we can do a roll call on all three.
all right, we're going to combine it, we're going to do a roll call on all three. Are everybody okay? Okay, the clerk?
Clerk will call the roll.
Ready? Senator Murray,
Aye by proxy.
Aye by proxy.
Senator Casey,
Aye by proxy.
Senator Baldwin. Senator Murphy.
Aye.
Senator Kane.
Aye.
Senator Hassan. Senator Smith. Senator Lujan.
Aye by proxy.
Senator Hickenlooper. Senator Markey.
Aye by proxy.
Senator Cassidy. Senator Paul.
No by proxy.
Senator Collins.
aye?
Senator Murkowski.
Aye by proxy.
Senator Braun. Senator Marshall. Senator Romney. Senator Tuberville. Senator Mullen.
Oh, aye by proxy.
Senator Budd. Chairman Sanders.
Aye.
I have 20 ayes, 1 nay.
Senator Collins, thank you for your common sense suggestion. All right. Okay, now I will call up Cassidy amendments 4, 5, 6, and 16 in that order. We'll consider each amendment individually, starting with Cassidy Amendment Number 4.
I spoke to all, in the interest of time, I spoke to all four of these in my opening statement. I would waive comments and assume that they would pass by voice vote.
Okay, that's fine. Senator Cassidy proposes that they be voice voted. I agree with that. All those in favor, please say aye.
Aye.
All those who are opposed, please say no. The ayes have it. The amendments are agreed to. And there we are. Senator Cassidy, you have one or two other amendments?
I do.
Right, yeah, yep. And you got to vote on the floor, too.
Mr. Chair, y'all got the votes. Y'all got the votes. You're the majority. Senator Marshall is joining with you. The lack of pay-fors will prevent this legislation from making it to the president's desk. I don't see the need to request votes on my amendments on top of some really good amendments that my colleagues are proposing, just to keep us here longer than we have to vote on legislation that will not become law. That said, it's important to raise the long list of issues that need to be part of the conversation as we discuss this reauthorization going forward, and to highlight that if the chair had dedicated the time necessary, we would be in a different place. So I'm going to offer and withdraw a series of amendments and not require a vote, just in respect of our time. So I would call up Cassidy Amendment Number 7, which would move the Sanders $3 billion mandatory capital funding to discretionary. And just to say, Congress has a spending problem. We can't afford to continue to operate on the mindset that every well-intentioned priority must receive mandatory funding to circumvent hard work that the Appropriations Committee does. We've seen in a luncheon conversation recently how mandatory spending has skyrocketed and discretionary spending has remained flat. And at least a portion of that is this attempt to circumvent what the Appropriations Committee, which is supposed to do, which is to have the tough conversations and not turn to mandatory spending when we complain, even when we say it's one time. Regrettably, I fear that the approach in this bill is a camel's nose under the tent allowing the establishment of a new mandatory funding stream that will continue to be funded. I hope my colleagues take this to heart, but I withdraw the amendment. Next, I pull up Cassidy Amendment number 20. Strikes the $3 billion in mandatory capital funding. Again, I will offer and withdraw. And I can say the same thing. It sounds great until you realize what this does. It circumvents the appropriations process in which, in an attempt to address our country's spending problem, our nation's debt and deficit, a ruse is constructed to bypass the caps that were negotiated between the White House and the House Center. By the way, health centers do great work. I want to reauthorize the program. But by establishing new mandatory funding streams and a new potential cliff, because we know we're going to hear about a cliff in 3 years, I think we should strike that. But knowing that you have the votes to pass, I withdraw this amendment. Next, I will offer and withdraw Cassidy Amendment 25. It adds fiscal responsibility and sustainability language to the $3 billion in mandatory capital funding. So we all support reauthorizing the health center program, but we can do it without a new capital funding stream. But for my colleagues who want more capital spending, I will say that even if the proposed spending is one time, as the chair promises, health centers presumably will increase their services, hopefully providing more dental and behavioral health services. That's a good thing, but we have to think about that. And we have to recognize that if we're going to facilitate more services, we have to understand the revenue stream, the business model of these. It may be that what we've done will create more demand for funding, perhaps mandatory in the future. It seems like we should understand that before we proceed with this. In medicine, internal medicine, we say don't just do something, think. If there's a time to actually think, I think that time is now. But with that, I withdraw the amendment. Next, amendment number 26. This amendment strikes Section 102B of the Bipartisan Primary Care and Health Workforce Act, returning the authorization of discretionary appropriations for health centers to the status quo. We have multiple HELP colleagues who sit on Appropriations Committee. I'm not saying anything that is new to them. In this environment, making numbers add up is extremely challenging. Republicans want more defense. Democrats want more non-defense. The Labor, Health, and Human Services bill, in particular, is always among the most difficult. Now, if we want to speak about changing the discretionary authorization for health centers, let's have that conversation as a full HELP committee. But we've had one hearing on health centers focused on the benefits health centers provide and, understandably, the pending mandatory funding expiration. Well, let's do it right. But instead of doing it right, the chair has opted to push some of the mandatory spending he originally would have preferred off onto the discretionary ledger. Surely, understand the appropriators don't have to honor the levels in his bill, but why are we doing this? As I said at the beginning, let's make a law, not a press release. But with that, I will withdraw the amendment. And now I think Senator Blood would like to present one of his amendments, if that pleases the
Chairman.
chair.
Absolutely.
Thank you,
Senator
Ranking
Budd?
Member. Thank you. So I have an amendment to S 2840, the Primary Care and Health Workforce Act. I'd like to call up Bud number 1. My amendment ensures that vulnerable patients continue to receive the maximum benefits of the 340B drug discount program. It gives the Health Resources and Services Administration the authority to verify that non-governmental hospitals that qualify for the 340B program have an active contract with a state or local government to provide care to low-income patients as required by the statute. Now, this will not cause an undue burden to grantees, since the grantees are already required to have these contracts on file. So I'm proud to support the 340B program and safety net providers and the work that they do to help low-income patients. I ask for a recorded vote on this, and I yield back.
I'm going to respond. Thank you, Senator Budd, for raising this issue. And while this amendment is well-intended, I'm afraid that as currently drafted, it could pave the way for pharmaceutical companies to offer fewer discounts on the products they manufacture. So I do think we need to take a look at 340B, and I look forward to working with you, but I will oppose your amendment. Senator Cassidy?
I thank Senator Budd for his amendment to bring additional accountability. We've seen bad actors, most notably in Richmond, Virginia. And I know that's of incredible concern to Senator Kane. A hospital supposedly serving the uninsured, a minority community in Richmond, instead taking all the 340B profits, returning it to corporate or returning it to suburban facilities. So I hope to work with Senator Budd and other members on this dais for additional and more comprehensive reforms to the program to ensure that the patient who should receive this is the one who does, and I thank him for his amendment.
Senator Cassidy, do you have other amendments you'd like to?
Okay, yes. You want to do yours?
Senator Budd, did you want to offer another amendment?
Thank you, Mr. Chairman. So I have two amendments to S 2840. And for efficiency's sake, I'm going to speak on them together. I'd like to call it Bud number 2 and Bud number 3. Bud number 2 extends the full Hyde protections to all of Title II of this bill. Bud number 3 prevents federal dollars from funding trainings on abortion. For decades, community health centers have provided much-needed resources to pregnant mothers and families without using taxpayer dollars to fund abortions. So I'm happy to see that protections are included in the traditional funding streams for community health centers. However, explicit protections are needed for funding streams that are not subject to appropriations. Whatever your personal views on abortion, I think we should be able to agree that taxpayer dollars should not be used to help take unborn life. I ask for a recorded vote on Bud number 2 and Bud number 3, and I yield back.
I would just remind Senator Budd that the lockbox provisions were removed from the legislation.
It's needed in the authorizing language, Mr. Chairman.
Okay.
And then,
Senator Cassidy.
first, I thank you, Senator Budd, and I appreciate your amendments to make sure that all funding is Hyde protected. So thank you for that. As regards Bud 3, I don't think that taxpayer dollars, and the American people in the past have not either, should be used to fund abortions or training in the provision of abortion. This amendment is modeled after a bill that passed the House in 2011 with bipartisan support. I want to be on the record. I think as a physician, I'm supportive of exceptions for the life of the mother, for rape and incest, for the health of the mother. And I'd like to continue to work with Senator Budd on figuring out the best way to draft this policy going forward. But I am supportive of making sure that taxpayers are not subsidizing abortion or the training thereof.
Senator Cassidy, do you have additional amendments? Or?
Yes. I will offer and withdraw number 62, amendment number 62, which cancels all the funding for this bill if the caps of the 2023 budget agreement are broken. We should ensure that this bill and all bills comply with the spending caps that the White House negotiated with the House Republicans, which was overwhelmingly supported by Senate Democrats, although you and I voted against it. It respects the taxpayer. It keeps the good faith of the agreement to prevent runaway spending during a time of persistent inflation. There is spending gimmicks within this to get around budget caps, and that goes against those negotiations. We must take a serious look at spending priorities. We know that some programs are not as effective. Let's cancel those. Let's put the money elsewhere. Otherwise, we're simply asking our descendants to pay for debt that we racked up because we could not choose between right priorities. And with that, I withdraw the amendment.
Okay, excuse me. Senator Baldwin, did you have an amendment you wanted to offer?
Yes, Chair Sanders, I have Baldwin 2 that I will offer and withdraw. For efficiency's sake, I would also like to make comments on the underlying bill, so I don't need to seek
Please.
recognition later. I want to draw attention to my amendment, which would add the Palliative Care and Hospice Education and Training Act, otherwise known as PACHETA, to this workforce package. This bipartisan bill, which I've long championed with Senator Capito, would grow and improve and sustain the palliative and hospice care workforce to keep pace with patients' needs and help improve the well-being of Americans with life-threatening illnesses and support their families. I will not be asking for a vote on this amendment today as a reflection of my continued commitment to keeping this bill bipartisan and out of respect for our process today. I do, however, request that the chair and ranking member work together to add Pachita to the next bipartisan markup so that we can finally address the urgent needs of the palliative care workforce. Senator Collins, Murkowski, and Marshall are all co-sponsors, and we would certainly welcome additional support from members of this committee. So thank you, Chair Sanders and Ranking Member, for your consideration. I now withdraw the amendment and wish to make express support for the investment in primary health care. But I want to make a strong statement regarding the Prevention and Public Health Fund, which is being used in this bill. I'm the chair of the Labor HHS Appropriations Subcommittee, and I have strong reservations about paying for aspects of this bill with cuts to the Prevention and Public Health Fund. The authorization for the Prevention and Public Health Fund specifically says that the funding is to be allocated by the Appropriations Committee. That funding has been allocated to specific prevention and public health programs in the Labor HHS Appropriations Bill for the last decade. Cutting funding for the Prevention Fund means cutting funding for the Labor HHS Bill. This year, as a result of the debt limit deal, the bipartisan Senate Labor HHS bill that we marked up in July spends apples to apples about $1 billion less in nominal terms than it did last fiscal year. Cutting the Prevention Fund will mean less funding is available for immunization programs, tobacco prevention programs, Alzheimer's disease, heart disease, and diabetes. It also means less funding for programs that help us protect our nation's children from harm. In Milwaukee, Wisconsin, more than 1 in 10 children have lead poisoning. That's not right, and the Prevention Fund helps us address it. If we choose to prioritize these programs in the face of cuts to the Prevention Fund, it means cutting other programs. I know members of this committee have priorities in the Labor HHS bill, including funding for medical research, responding to the opioid crisis, and preventing cancer. All of these programs are at risk if we cut nearly $1 billion from the Prevention Fund, as this bill would do. I look forward to working with the chairman and other members of this committee to make sure that we don't do that as we move this bill forward. But again, overall, the overarching bill is critical, and we should seek other funds to make it happen.
Thank you, Senator Waldman. Senator Markey, did you have an?
I was going to comment on that. Yeah, one, I thank you for your amendment on the your underlying amendment. It's a good amendment, and it needs support. I also thank you for, and you may have done that inadvertently, but pointing out the shortfalls in the process by which this spending is being offset. It wasn't with full consultation of all members of both sides. It's done in a way which is kind of, where is there money that we can go after, and let's go after it. And that ends up cutting other priorities essential to our nation's health. But I yield back.
Thank you. Senator Markey, did you have an amendment?
I do, Mr. Chairman. Thank you so much. Thank you, Ranking Member Cassidy, as well, for considering the important topic of primary care. I request unanimous consent to offer a modified Markey Amendment Number 1. Without objection.
I object. You cannot modify an amendment.
Thank you. And I thank you for your consideration. There was a mistake in the drafting, but the intent I'm going to make quite clear, and we could modify it as this bill moves further down the process. So we thank you for your consideration, and I'd like to proceed with consideration of the underlying amendment. I'd like to start with sincere appreciation to Chairman Sanders and to Senator Marshall and Senators Hassan and Murkowski on their partnership on this amendment. Community health centers are the front door of care. When people don't feel good, they know they can go to their community health center. And with over 12 million Americans seriously thinking about suicide and over 100,000 overdose deaths in a single year, it is important that the front door can serve everyone without stigma or shame. This amendment requires that community health centers provide mental and behavioral health and substance use disorder care and is intended to give them the resources they need to do this. We are investing $5.8 billion in community health centers, and we have come to a bipartisan agreement that at least $500 million of that funding must be dedicated to help healthcare centers implement this requirement and scale up their services. For too long, we've asked community health centers to meet the demand that is too high with too little resources, and that has to end, and this is a part of that effort. This amendment also recognizes that community health centers are one piece of the puzzle. Health centers will use these resources to build systems that add to the ecosystem of certified community behavioral health centers, hospitals, and health systems. This amendment will ensure that community health centers strengthen these networks of care. This is not the end of the conversation, but it's a path forward, and I look forward to ensuring community health centers are funded to provide mental and behavioral health and substance use disorder care. And I request a roll call vote on Markey Amendment number 1.
Senator Markey, thank you very much for offering the amendment along with Senator Hassan and Murkowski. You are raising, obviously, the enormously important issue of the mental health crisis in America. Unbelievably, in 2022, we lost nearly 50,000 lives due to suicide and over 100,000 from overdose deaths. And, clearly, this is an issue that we've got to address. We must ensure that more Americans can access the critical behavioral health services that they need. And Senator Markey's amendment will bolster that access for people across the country. Senator Marshall and I are supporting this amendment with the bipartisan understanding that $500 million of the mandatory health center funding in this bill would be dedicated to help health centers implement this requirement. And I will be urging a yes vote on the amendment.
Thank you, Mr. Chairman.
Senator Cassidy.
I thank Senator Markey for offering the amendment. And as you know, I've worked with Chris Murphy and others for the bipartisan, the 2016 bipartisan bill on mental health. But I'm going to oppose this amendment because it's a little counterintuitive. If you mandate services from entities which are, we hear, underfunded, and for which there is already a shortage of mental health providers, but they've got to do it, then you put them in a little bit of a squeeze box. There's not the provider, but they've got to do it. Now, what happens is they end up having to pay top dollar to some third party that will provide the funds that normally they can negotiate, but the third party knows this is mandatory, so therefore they charge them more than they ordinarily might. The health centers are so committed to this. And in the Safer Communities Act, which passed on a bipartisan basis and which I worked on, it already gives a lot of funding to community health centers to provide these services. And so, I think it's going to this is a well-intended amendment, but without actually having a hearing and discussing this with the stakeholders, I'm not sure we'll have the intended impact.
Senator,
And with that, I would ask for a roll call on it, Mr. Chairman.
Okay.
Thank you.
other,
Mr. Chairman,
yeah, Senator.
I have 3 amendments I'd like to call up. Amendment 1, 2, and 3 here. Number 1 is exposing hospitals violating Price Transparency Act. In my time in trying to get hospitals and insurance companies accountable, they generally try to skirt anything you put out there. This bill simply requires the CMS to publish a list of the hospitals that are not in compliance with the Hospital Price Transparency Rule, which requires hospitals to provide clear, accessible pricing information online about the items and services they provide. The list must include any hospitals that have received a written communication from the CMS about potential non-compliance. The bill also requires the GAO to report on compliance and enforcement of the price transparency rule, including recommendations for improving price transparency to patients, employers, and the public. And I would like a vote on that.
Well, let me just say that I agree with Senator Braun that hospitals must disclose their prices as required by law, and I'll be urging my colleagues to vote yes on this amendment.
Thank you, Mr. Chair.
I applaud what Senator Braun is getting, but this is actually an important policy. It's something that we should have had a hearing on. And that's just one more thing that we would be voting on, which we've not had a hearing. I would like to hear from my hospitals. I've learned from my hospitals that sometimes the reason they're not publishing is because they don't have the adequate resources. It is a critical access hospital barely keeping the doors open. I'm not speaking about a corporate hospital. I'm speaking about a rural hospital which is truly trying to keep the doors open. And so I would like to have a fuller consideration of this. I am extremely supportive in concept, but once more feel like this is something which deserves a hearing as opposed to the process we've had. So I will unfortunately oppose.
Senator Braun?
Amendment number 2, Train More Nurses Act. This is along with Senator Hassan. This bill directs HHS and DOL to assess existing grant programs and provide suggestions for changes that would improve upon the goals of increasing nurse faculty, particularly in underserved areas, including options for pathways to support nurses with over 10 years of experience to become faculty, and encouraging and increasing the nursing pipeline through pathways for LPNs to become RNs.
I think this is an important and smart amendment and something that I very strongly support. The key drivers of the nurse faculty shortage in America, such as low faculty salaries and antiquated facilities, this is an issue that must be addressed, and I appreciate Senator Braun's amendment. Senator Braun, did you have a comment? I'm sorry.
And by the way, thank you again, Senator Braun, because it shows that members of this committee are still seeking information about our current nursing workforce and how they can be improved. I agree the type of information this report collects is helpful. It's the information that would have been helpful to inform the drafting of this base bill. But it's troubling that the chair would bring up legislation to reauthorize several Title VIII nursing workforce programs without properly evaluating their efficacy. The Title VIII programs are up for reauthorization in 2025 and are due proper consideration through regular order next year. We have an obligation to the taxpayer to do our homework when it comes to reauthorization. Therefore, I'll vote yes on this amendment to ensure we have the information needed to inform Title VIII work next year.
Senator Braun?
Finally, Braun Amendment number 3, and I think most important of the 3. This bill, called the Healthcare Price Transparency Act, provides statutory authority for requirements for hospitals and health insurance plans to disclose certain information about the cost for items and services. Specifically, hospitals must publish in their list of standard charges certain rates negotiated with insurers, discounts for cash payments, billing codes. Further, hospitals generally must publish the standard charges for the services provided by the hospital that they may be scheduled in advance. Additionally, insurance plans must publish the in-network and out-of-network charges for covered items and services and the negotiated prices for covered prescription drugs. Plans must provide a tool for consumers to search for this cost information. Consumers also may request additional information about the costs of specific items or services under their plans. Until the healthcare industry is willing to do what all other businesses do, tell us what things cost and make it easy, there's going to be a constant barrage from consumers of healthcare, and I think those of us that want to make it a better place going to keep coming at them. This ought to be the easiest of the 3 to be for.
Well, let me just agree with Senator Braun. Patients have a right to know how much hospitals and insurance companies are charging them, and I will be urging a yes vote on that. Senator Markey, did you have? I'm sorry, Senator Cassidy.
Again, I'm not opposed to the policy. In fact, I have pushed for price transparency in times past. It is something that actually should have been considered in a committee. It's something that is going to have far-reaching implications. And stakeholders, not just corporate hospitals, but like hospitals which are really frontline. Again, the essential hospital, the letter I quoted is from the essential hospitals, the ones who are treating those who are most vulnerable and marginalized. I'd like to hear what their thoughts are. I strongly support the concept, but again, it should have had a fuller hearing.
Thank you.
Chairman, quick response to that.
Brief.
Even for these essential hospitals, which would be the rural ones, the ones hanging on by their fingernails, they should use this as an opportunity to differentiate themselves from the corporate hospitals. And you can't be for transparency, getting rid of barriers to entry and competition, regardless of where you're at on the food chain. That's a hard one to say, to defend against.
And if I can respond to that.
Briefly.
And what we have learned, what I have learned, is that if you've got 400 different plans with which you are negotiating, and sure, it may all be United, but United is the third-party administrator for a business like your family's, that it's logistically difficult for the hospital to be able to track what is the price for this patient for that plan. And so it isn't that they don't want to comply necessarily, it's that the logistics of our current system make it difficult for them to do so. And to hold them and to penalize them for not being able to achieve something when United may not be giving them the information for that particular patient is difficult. Some have done it, and they put a lot of resources into it. If you don't have those resources, you'd be out of compliance, perhaps busted, and we need to be fair to those.
Okay, thank you. Senator Markey, did you have
Yes,
an
I do.
amendment?
Thank you, Mr. Chairman. I'm making this amendment on behalf of myself and Senator Braun, and I thank you, Mr. Chairman, and Senator Marshall for your help on it. When we spend money on community health centers that provide holistic and compassionate care, we are spending money to make sure that people can get the health care they need when and where they need it. And when people can get affordable, high-quality primary care in their neighborhood, they get the tests, the screenings, vaccines, and referrals they need, so they don't end up sick or hospitalized just because their healthcare provider was too booked up, too far away, or too expensive. That is why, in partnership with Senator Braun, I have submitted an amendment to have the Secretary of Health and Human Services report back to Congress on the effects of our investments in community health centers. This report would bring to light that bold investments in our community health centers will save money for Medicare, Medicaid, and the Children's Health Insurance Program. It would report on how investments in community health centers pays dividends in patient access and experience. It would highlight that investments in local communities can transform them with boosts to their local economies and job opportunities. Investing in our communities just doesn't save lives, it saves money and time for our community members who have the least of both. We would hope, Senator Braun and I, that all will join us in voting yes, and we request a roll call on that amendment.
Thank you, Senator Markey, and I would urge my fellow colleagues to vote yes on your amendment.
Can I go this?
Senator Cassidy, did you
Yeah.
want to?
Again, I thank Senators Markey and Braun for the amendment. I would have written it a little bit differently. We need to be looking at the full funding streams of these community health centers. That's one thing we learned. They're right now having additional revenue because of 340B and additional revenue because of Medicaid expansion and additional revenue for something else and something else. And by the way, I'm pleased about that. They need a diversification of revenue. We have one hearing. I wish we'd had more to kind of further explore that. Now, I hope this doesn't circumvent CBO scoring rules. The fact is we live beneath CBO, and folks are hoping that we can circumvent the lack of a CBO score, which we don't have on this, by saying, you know, ex cathedra, that we're going to save money just by and fill in the blank. So I like this amendment in the sense that it gives us some additional helpful information. I'll support it, but we got to live under CBO. It's not magical around here, as much as we'd like to have magical thinking.
Okay, good, thank you.
Okay,
Thank you.
thank you. Senator Cassidy, did you have one or two more amendments?
Yes. You have another one? Yes, I will offer and withdraw Cassidy Amendment number 13 to direct the Department of Health and Human Services to work with the Academy, National Academies of Science, Engineering, and Medicine to determine long-term nutrition habits. Promoting nutritional habits is an important aspect of healthcare. I can tell you, a lot of what we have is nutritionally driven, and it must be done in a transparent and evidence-driven manner. Many of the programs in the chair's bill have not been thoroughly vetted. They lack definitions and their scope is overly broad. This bill, for example, would direct HHS to examine how to offer nutrition services paid for through Medicare and Medicaid, a potentially costly prescription for American taxpayers, particularly when Medicare solvency is a major issue. My amendment would require that considerations for expanding nutritional services at community health centers be based upon independent scientific evidence. I am committed to finding ways to improve nutritional habits through our population, but not by throwing unvetted, costly requirements at community health center programs. With that, I offer and withdraw.
Continue, Senator Kessler.
Thank you, Madam Chair. Next, I'll offer and withdraw Cassidy Amendment number 19. This is strike Section 102C, which establishes a new, quote, allocation of funds, quote, section in statute, and amends the Public Health Service Act to underscore existing ways that Senator Sanders could address priorities. I've already made clear my concerns on the chair's newly prescriptive directives for how community health center fund and how the community health center funding and capital funding will be spent. There are other ways that Congress could signal support for expanding health centers' hours of service and prioritizing dental and behavioral health. Expanded service grants exist under current law, and the chair's priorities could be made clear by amending the authorizing statute for those grants. I know the chair wants mandatory spending, but there are other ways. Once again, the single hearing we had on health centers was insufficient to consider a policy change of the magnitude the chair is proposing. That's not how we should be doing business. I hope my colleagues think about this, but I understand the votes are there, and so therefore I will withdraw my amendment. Madam Chair. And next, I'll pull up Cassidy Amendment number 21, striking the term school-based health sites in both places where it appears in the bill. Aside from being apparently improperly drafted, I'm concerned with the precedent the chair's bill establishes in adding this program to the mandatory Community Health Center Fund. Funding for the school-based health centers are currently authorized through FY26 and does not require authorization at this time. Further, this funding has not historically been referenced in the Community Health Center Fund, so it appears the chair's intent is to shift more discretionary spending onto the mandatory ledger. Now, once something like this gets added to the law, it becomes an expectation. And then, my gosh, we have another funding cliff. And, my gosh, mandatory spending continues to increase when it should be subject to discretionary priorities. The single hearing we had on health centers was not a thorough community review of the policy change of the magnitude of which we are now addressing. Furthermore, school-based health centers are specifically prohibited from performing abortions and required to comply with state laws on parental consent and notification. These requirements are missing from the new school-based health sites term. So a school-based health center could be considered by some smart attorney as different from a school-based health site, and a school-based health site would not be subject to the same high protections. It raises the question, was this a deliberate attempt to avoid these requirements? I hope my colleagues appreciate my frustration, and those who are pro-life support my frustration, but with that I withdraw my amendment. This is what? This is similar, but again, it's important. It would strike the term school-based health sites in both places it appears and replace with school-based health centers. Let me just put aside for a second the chair's precedent for mandatory funding for school-based health centers to focus on something more nuanced. I don't know why the chair's bill is drafted with the term school-based health sites, but there is an existing term in statute that accomplishes this objective. Perhaps an oversight, perhaps unintentional, but it could be intentional due to the abortion prohibitions and parental consent requirements that exist in statute for school-based health centers. Again, aside from the policy concerns, we're going to proceed with this bill. It should be done right and use a proper definition, which is what my amendment proposes. Unfortunately, this amendment seems like either another indicator that the bill was rushed, or worse, a clever attempt to shift more discretionary spending into the mandatory ledger or to circumvent Hyde protections. But you got the votes, so I withdraw the amendment. Say it again. With that, I call up amendment number 34. Privacy, this would add privacy protections to Section 301, which bans anti-competitive terms in facility and insurance contracts that limit access to higher quality and lower cost care. Privacy protections are critical to Americans' health information, and including references to existing health privacy laws and statute is important standard practice. My amendment adds back privacy protections that were included as part of this provision the last time the committee considered the language as part of the Lower Health Care Cost Act. Senator Sanders' bill specifically omits privacy protections from a previously reported HELP bill. This raises questions about intent, another example of legislation being perhaps unfinished and rushed. This omission is one of the many policies that were rushed, adding Section 301 to the bill before it was presented to us. At the 11th hour, the chair airdropped policies in a bill for markup that both the Department of Labor and Department of Treasury noted were unimplementable and inappropriate for inclusion in this section. But with that, I withdraw the amendment. Cassidy Amendment number 36, requiring the Secretary to certify that the requirement for off-campus hospital outpatient departments to bill under a unique provider identifier will not lead to more consolidation prior to the provision going into effect. The assumption of this provision is that it creates more transparency, which leads to more competition. But I fear that this provision could actually lead to more consolidation among health providers due to the additional administrative burden on the smaller provider. Unfortunately, the process by which the package was put together did not allow for the consideration of this impact of Section 302 on small and rural providers. It's essential that the impact of this provision is accurately assessed, which is why I'm offering this amendment to require the Secretary to certify that this will not lead to more healthcare consolidation. But with that, I withdraw the amendment. I understand writing on wall. Next, Cassidy Amendment 37. The amendment ensures that professional fees are not captured within the ban on facility fees. I will not support language that may inadvertently capture other fees, such as professional fees, that importantly provide physicians with compensation for their time and skill. There's a concern that the way the facility fee ban is written could also ban professional fees if the professional fee is bundled with the facility fee. And this is what you get from having a hearing where you actually speak to providers as opposed to assuming you know what's best for them. It's unfortunate that the bill intentionally uses language that leaves open questions as to what providers are allowed to bill for. Again, moving hurriedly drafted legislation could have devastating impacts on healthcare providers. This is an example, but it ain't going to be accepted, and I withdraw it. Next, Cassidy Amendment number 39. The Bipartisan Primary Care Health Workforce Act authorizes $3 billion for capital improvement projects to eligible health centers. This amendment prevents the application of Davis-Bacon Act provisions for construction authorized under this act. For what it's worth, the Associated Builders and Contracts submitted a letter supporting this, and I offer that for the record. If the intent is to increase access to health care through new and improved facilities, we should make sure that we're maximizing the funds taxpayers are providing for the actual construction of facilities. The GAO, the OIG, and economic studies consistently say that Davis-Bacon wages are incorrectly calculated, and as a result, taxpayers are paying inflated rates for construction cost. The Congressional Budget Office calculates that repealing Davis-Bacon would save the government $24 billion over 10 years. That kind of money, apportioned for these clinics, could treat a lot of patients. I mean, if we really care about patients, we want to maximize the dollars, this is a good policy. A study from Beacon Hill from May 2022 finds the application of Davis-Bacon increases the cost of construction by 7%, and also found that wages calculated by DOL are 20% higher than those calculated by the Bureau of Labor Statistics. These costs don't take into account the administrative paperwork of weekly certified payroll requirements submitted to DOL. But with that, I withdraw the amendment. Next is Cassidy number 41. This amendment would require entities receiving grants under the Rural Residency Planning and Development Program to be evaluated for effectiveness in achieving the purpose of the grant before receiving an extension. Republicans would have pushed for this. If we had had actually an open process where we had actually met on this, Republicans would have pushed on this. But we don't have it. The underlying text leaves grant extensions to the Secretary's discretion. If we're going to spend the money, we need to ensure it's being used effectively. We need to know what works and then expect grantees to use that which works. It's common sense, good governance, but I withdraw the amendment. I then offer Cassidy Amendment number 43. This would move the proposed health care workforce innovation program within our existing workforce system under the Workforce Opportunity and Innovation Grant, or WIOA. Our existing workforce system is designed to do what is being proposed under the new Healthcare Workforce Innovation Program. We need to think, not just spend. So duplicating existing efforts in a new program will not yield the results we're looking for, but instead create a new bureaucracy for individuals to navigate. I propose to move the new grant program to becoming a part of our existing workforce programs to eliminate duplication, increase efficiency, and get more people trained to enter allied health professional jobs faster. But with that, I withdraw. I now offer and withdraw Cassidy Amendment number 45.
Before you go, Senator Cassidy, can I ask a favor? Do you have, do I understand you're going to ask for one roll call vote? Is that correct, or was there more than that?
I think I'm
In respect to our colleagues, do you have a sense of when we could ask for a vote final?
I only have 3 or 4 more to offer and withdrawal, so I would beg the chair's indulgence for those 3 or 4 to be brought up.
You sure got it. And after that, we can go to the votes, then I'm
Yeah.
hearing from you. Hold it. Yeah, Mary has, yeah, we'll get that as well. Okay, thank you, Senator Cassidy. Go ahead.
I call up Cassidy Amendment number 45, which will require grant applicants under the Rural Residency Program and Development, Rural Residency Planning and Development Program to demonstrate some base experience in healthcare or track record of working with primary care physicians in rural areas. If we're going to spend money on planning, we should target entities where the dollars can have the greatest impact and opportunity for success. That is not an unreasonable expectation. And if Republicans had been allowed to negotiate on that, Republicans would have pushed for that. But instead, we're going to have money flowing out the door, probably to politically well-connected people, and not achieving the goals of which taxpayers think their money is going to be actually spent. But with that, I withdraw. Next, I offer and withdraw number 56. To prevent duplication and confusion by moving the Allied Health Professionals Dual Enrollment Program from the Public Health Service Act into the pre-existing framework within the Perkins Career and Technical Education Program. The Perkins Career and Technical Education Program already provides career and technical education assistance to states, which can be used to secondary schools to provide career exploration and career development activities. Duplicating existing efforts in a new program creates inefficiencies and confusions, and Republicans would have demanded that this be part of it, and I think Democrats may have concurred. And I propose expanding the current program in Perkins to allow secondary schools to support the exploration of and development of allied health professions. Schools will be able to make better use of the funds faster if they're accessing through an existing familiar structure. Again, we shouldn't just spend money, we should think about how we spend. But with that, I withdraw. Almost through. This is going to be Cassidy Amendment 57, to require coordination between allied health profession grants and existing apprenticeship program. The proposed Healthcare Workforce Innovation Program is meant to expand the supply of allied health professionals working in underserved areas, communities and rural areas. but state apprenticeship agencies already work with local employers, including healthcare providers, to identify need and to fill open positions through new registered apprenticeship programs. Apprenticeships registered under either a state apprenticeship agency or nationally by DOL can provide a solid framework to fill open allied health professional jobs. Requiring coordination with existing systems will prevent duplication and confusion for would-be workers and employers. Republicans would have requested that. It actually uses dollars more wisely and helps the employer do better, but I withdraw my amendment. Offer and withdrawal number 58, which would require the Secretary to prioritize schools employing nurse faculty with practical experience in their field for grant funding. I've worked with school-based clinics. There's a lot of untapped knowledge from those who've been working in the field that should be brought into the classroom. Those with hands-on experience bring just as much, if not more, to students. It also signals that under this demonstration, faculty do not have to be full-time. Ideally, they continue to work in the field and teach part-time. We should be encouraging it, or at the very least, studying it under a demonstration. I would have liked to have been able to bring my practical experience at working with graduate medical education and graduate nursing education for that purpose, but I withdraw the amendment. And then this is the amendment of which I would ask a vote, and this is...
Mr. Chair.
I'm sorry.
Mr. Chair, just,
Yes.
might I just ask a question to the ranking member before he moves on, or just offer a comment? You've said a couple of times you're withdrawing amendments because you can see the writing on the wall, and you kind of say that dismissively. That's actually a really important trait. I've never been able to read the writing on the wall, and I just wanted to acknowledge that.
What can I say? Every now and then I tell my wife that maybe we should go on a different vacation, but she's got all the kids lined up. And I know in the vote that's going to take place, we're going on the vacation they want to take. We're going to the beach, not to the museum. I've learned to count votes.
Senator Cassidy, you had another amendment.
And do you want to go with Lujan? Because this is my last
Sure.
amendment.
We've got, I think you have one more. Senator Lujan has one, Bob Casey has one, and Ed Markey has one. Okay, that's it. Bill, do you want to offer yours now, or do you want to wait? Do you want to offer your amendment now?
I'm talking to my staff. So
Okay, that's fine. Senator Lujan?
Thank you, Mr. Chairman. I call up Lujan Amendment Number 1.
Please.
Mr. Chairman, before I get to my amendment, I just want to recognize your work and that of the committee, all the staff that were part of this as well, but recognize an important provision in here around Project ECHO. Dr. Sanjeev Arora from the University of New Mexico is quite extraordinary in his vision to connect more providers together in a virtual space to diagnose big problems and keep people healthy. It has been working. 250 hubs in almost every state, sir, and across the country. So I just want to thank you for that. Mr. Chairman, I raised this amendment today because we know competition is good in the drug marketplace, and it will increase access to lower-cost biologic drugs. I want to thank my partner, Senator Lee, and his staff for their work on the bill that this amendment is based on, the Biosimilar Red Tape Elimination Act, as well as co-sponsor Senator Paul and Senator Braun. This amendment would allow biosimilar manufacturers to not have to conduct additional costly and time-consuming studies after they have been approved as a biosimilar. The FDA has all the authority they need in the first step of this process to ensure that biosimilars are safe and effective for Americans. The FDA's two-tiered system for approval has confused physicians and patients, and we can fix this. Lowering drug costs is a priority to all of us on this committee. A RAND Corporation study estimates that biosimilars are on track to save Americans $38.4 billion over 5 years. Now, Mr. Chairman, the FDA has already taken some steps, and they have taken recent actions to move away from this two-step process because it recognized it to be an unnecessary barrier. And I plan to withdraw this amendment, Mr. Chairman, if I can get your support to work with myself and Senator Lee.
Absolutely.
And to our ranking member, Mr. Cassidy, you have so much experience and thoughtfulness in this space, if we could get your support here to work myself and Senator Lee. I withdraw the amendment. Thank you, Mr. Chairman.
Okay, wonderful. Thank you, Senator Lewin. Senator Casey?
Thank you, Mr. Chairman. I want to call up Casey Amendment Number 2, and I'll just talk about it briefly. As everyone knows, teaching health centers provide community-based training for new doctors in communities across the country. but the per resident allowance, that allowance that the teaching health centers receive currently at $160,000 per year, hasn't kept up with their costs. This makes it harder for them to provide a competitive opportunity to their residents. My amendment would increase that per resident allowance by just $10,000 per year to get closer to the true costs of about $210,000 per year. The amendment is supported by the American Association of Teaching Health Centers, so I look forward to having a vote on that amendment. Thank you, Mr. Chairman.
Thank you, Senator Casey. I think this is an important amendment. I support it. Senator Cassidy, Senator,
I was going to comment on that.
okay, Senator Cassidy.
Yeah. So, the Children's Hospital Graduate Medical Education Program, where am I? I'm sorry. Thank you, Senator Casey. The committee should have evaluated programmatic changes and not just argue over funding levels to the Teaching Health Center Graduate Medical Education Program months ago, with proper time for members to reach consensus on how best to reach the per resident amount. Absent these hearings and absent this understanding, although I understand the issue, I just got to say once more, we shouldn't just do something, we should think. And we've not had the opportunity to examine it in committee. I shall oppose.
Senator Marshall, did you want to offer something into the record?
I do need to get something for the record on behalf of Senator Murkowski from the great state of Alaska. She has a letter of support for this legislation, and briefly, she points out that we certainly have rural places in Vermont and Kansas and Louisiana, but my goodness, she has rural locations. And certainly everybody in my conference knows this. I want to make sure my folks across the aisle understand that Alaska is 3 times bigger than Texas. Wow. You're supposed to laugh. Come on, folks.
That's true. Okay. Senator Cassidy, I wanted to say I appreciate very much your willing to expedite the process and your cooperation in that. Do you have an amendment now that you would like a roll call vote on?
I
Is that
do.
correct? Yeah. Please.
This amendment would provide a 2-year extension for the community health centers, the National Health Service Corps, and the Teaching Health Center GME program. Based on my bill, the Community Health Care Act, this amendment provides funding increases to all 3 programs. It's high protected. It can be fully paid for. I hate to say it, but the bill that we're considering now is frankly more about a press release. And my amendment is about what can become law. I support community health centers. I've worked closely with them in my practice and in my congressional career. And that's why I want to provide them with the certainty that they have asked for. This policy that I'm proposing passed unanimously out of Energy and Commerce, unanimously out of the House of Representatives. That's just amazing. Democrats and Republicans recognize the value of increasing the program, but not to create a massive future cliff. The current funding for community health centers expires in about a week. And it's disappointing, as I've said earlier, that after months of effort, we've arrived at this moment marking up a bill which is not paid for. I've heard people say we shouldn't be limited by what the House does. What we haven't noticed, our Constitution says we are limited by what the House does. And if we think that we're going to propose something that increases funding and the House of Representatives is just going to swallow it, it ain't going to happen. And why don't we be realistic? But we don't make, in this amendment, we don't make promises that we cannot keep. We make promises that can be signed into law. And with that, I strongly urge colleagues to support my amendment.
I would just respond to
And that's Cassidy number 1. I'm sorry I did not say that.
I would just respond to Senator Cassidy by saying the time is long overdue where we begin to deal with the crises facing American healthcare, a need for major reform in healthcare workforce and primary care. And we do that, and it is my every intention to make sure that that becomes law. With that, again, I want to thank Senator Cassidy for helping to expedite the process. I think we're now ready to take some votes. Senator Markey? Briefly.
Briefly, I have 1 minute on an amendment I'm going to withdraw, which is an amendment today to remove site-neutral requirements for telehealth fees because we don't need to be adding barriers to telehealth to pay for these primary care investments that already pay for themselves. To put it another way, we don't need to rob Peter to pay Paul when Paul is already getting paid. Telehealth services are a lifeline for disabled and immunocompromised people who can see their provider without risking their health, for elderly, low-income patients who struggle finding transportation to get to their doctor's office is a challenge, for substance abuse disorder patients who have been able to see their providers without hours-long trips, and for LGBTQ patients who face discrimination, harassment, and assault at brick-and-mortar medical facilities. I think we should continue the conversation on this, but I think we need to head in a better direction, but I withdraw the amendment at this time.
Thank you, Senator Markey. You're right. We need to continue that discussion, and we will.
And can I comment on that?
Briefly.
Yeah, thank you, Senator Markey. I'll point out that the concern you raised and similar concerns, and I'll submit these for the record, is why America's Essential Hospital doesn't like this bill, why the AHA doesn't like the bill, like the FAH doesn't like the bill. All hospital organizations, they don't like this bill. And why, and just to also make the point, as we speak about workforce, the Association of American Medical Centers, medical colleges doesn't like this bill. So the stakeholders, the ones that theoretically we're just throwing a lifeline to, don't like this bill. There's one more thing I'd like to submit for the record, which I should have done earlier. Senator Grassley, well, never mind, I scratched that. I'll pull that. Thank you.
Thank you very much. Okay, we're going to go to the vote.
Senator Sanders?
Yeah, very briefly.
Just very briefly, Senator Markey, I would look forward to furthering the discussion, but I will point out that hospitals have been charging 2, 3, 5 times as much as non-hospital services for the exact same service, sometimes telehealth, and it drives patient costs up. So I look forward to working with you on this, but I do think transparency and site neutrality is really important. Thank you.
Thank you very much, and I agree with Senator Hassan. Okay, we are now going to be voting on Bud Amendment number 1. The clerk will call the roll.
Senator Murray? No. Senator Casey? No. Senator Baldwin?
No by proxy?
Senator Murphy? Senator Kane?
This is Bud 1.
Yes.
Senator Hassan? No. Senator Smith? Senator Lujan? Senator Hickenlooper? Senator Markey? No. Senator Cassidy?
Yes.
Senator Paul?
Yes by proxy.
Senator Collins?
Yes by proxy.
Senator Murkowski?
Not voting.
Senator Braun?
Yes by proxy.
Senator Marshall? No. Senator Romney?
Not voting.
Senator Tuberville?
No by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd?
Yes by proxy.
Chairman Sanders?
No. Yeah,
14, 1, 2.
I think we can do that. Are you here in person? All right, if you're here in person, we'll do that.
An AI hallucination.
Okay. Clerk, what you got?
I have 6 ayes, 13 nays.
Okay. We now go to Bud.
Excuse me. Senator Paul asked that his staff asked that he be changed to a no.
Okay. You got that, Paul, is no. By
Paul is
proxy.
no.
Or 5, 14.
Okay, we're now going to Bud Amendment number 2. Clerk will call the roll.
Senator Murray? No. Senator Casey? No. Senator Baldwin? No. Senator Murphy? No. Senator Kane? No. Senator Hassan? No. Senator Smith? No. Senator Lujan? No. Senator Hickenlooper? No. Senator Markey? No. Senator Cassidy?
Yes.
Senator Paul?
Yes by proxy.
Senator Collins?
Yes by proxy.
Senator Murkowski?
Not voting.
Senator Braun?
Yes by proxy.
Senator Marshall? Senator Romney?
Not voting.
Senator Tuberville?
Yes by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd,
Yes by proxy.
Chairman Sanders,
No.
I have 8 ayes, 11 nays.
The noes have it, and the amendment is not agreed to. We'll now go to Bud Amendment number 3. Number 3.
Senator Murray,
No.
Senator Casey? No. Senator Baldwin? No. Senator Murphy? No. Senator Kane? No. Senator Hassan? No. Senator Smith?
No by proxy.
Senator Lujan? Senator Hickenlooper? Senator Markey? No. Senator Cassidy?
Yes.
Senator Paul?
Yes by proxy.
Senator Collins?
Yes by proxy.
Senator Murkowski?
Not voting.
Senator Braun?
Senator Braun?
Senator Marshall? No.
Marshall is aye? Okay.
Senator Romney?
Not voting.
Senator Tuberville?
Yes by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd?
Yes by proxy.
Senator Braun? Yes. Chairman Sanders?
No.
I have 8 ayes, 11 nays.
The nays have it, and the amendment is not agreed to. Now we will vote on Markey Amendment number 1. Clerk will call the roll.
Senator Murray?
Aye.
Senator Casey? Aye. Senator Baldwin? Aye. Senator Murphy? Aye. Senator Kane? Aye. Senator Hassan? Aye. Senator Smith?
Aye by proxy.
Senator Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy?
No.
Senator Paul?
No by proxy.
Senator Collins?
No by proxy.
Senator Murkowski?
Not voting.
Senator Braun? Yes. Senator Marshall? Aye. Senator Romney?
Not voting.
Senator Tuberville?
No by proxy.
Senator Mullen?
No by proxy.
Senator Budd?
No by proxy.
Chairman Sanders?
Aye.
I have 13 ayes, 6 nays.
The ayes have it, and the amendment is agreed to. Now we will vote on Braun Amendment number 1. The clerk will call the roll.
Senator Murray?
No.
Senator Casey?
What's the story? All right, I'm going to vote yes, but some people will vote no.
No vote. No.
Senator Baldwin? Senator Murphy? Senator Kane? Senator Hassan? Senator Smith?
Aye by proxy.
Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy?
No.
Senator Paul?
No by proxy.
Senator Collins?
No by proxy.
Senator Murkowski?
Not voting.
Senator Braun? Senator Marshall? Senator Romney?
No by, I'm sorry, not voting.
Senator Tuberville?
No by proxy.
Senator Mullen?
No by proxy.
Senator Budd?
Yes by proxy.
Chairman Sanders?
Aye.
Mr. Chairman,
Yes, Senator Casey? Senator Murray?
I will change my vote to a yes.
Okay. Yeah, 2 more yeses here.
I have 13 ayes, 6 nays.
The ayes have it, and the amendment is agreed to. We'll now do Braun Amendment number 2.
Senator Murray?
Aye.
Senator Casey? Senator Baldwin? Senator Murphy? Senator Kane? Senator Hassan. Senator Smith.
Aye by proxy.
Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
Aye.
Senator Paul.
Aye by proxy.
Senator Collins.
Aye by proxy.
Senator Murkowski.
Not voting.
Senator Braun. Senator Marshall. Senator Romney.
Not voting.
Senator Tuberville.
Aye by proxy.
Senator Mullen.
Aye by proxy.
Senator Budd.
Aye by proxy.
Chairman Sanders.
Aye.
19-0. I have 19 ayes, 0 nays.
The ayes have it, and the amendment is agreed to. We'll now do Braun Amendment Number 3.
Senator Murray. Senator Casey. Senator Baldwin. Senator Murphy. Senator Kane. Senator Hassan. Senator Smith.
Aye by proxy.
Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
No.
Senator Paul.
No by proxy.
Senator Collins.
Aye by proxy.
Senator Murkowski.
Not voting.
Senator Braun. Senator Marshall. Senator Romney.
Not voting.
Senator Tuberville.
No by proxy.
Senator Mullen.
No by proxy.
Senator Budd.
Yes by proxy.
Chairman Sanders.
Aye.
I have 15 ayes, 4 nays.
The ayes have it, and the amendment is agreed to. We'll now vote on Markey Amendment Number 2. Clerk will call the roll.
Senator Murray.
Aye.
Senator Casey. Senator Baldwin. Senator Murphy. Senator Kane. Senator Hassan. Senator Smith.
Aye by proxy.
Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
Aye.
Senator Paul.
Aye by proxy.
Senator Collins.
Aye by proxy.
Senator Murkowski.
Not voting.
Senator Braun. Senator Marshall. Senator Romney.
Not voting.
Senator Tuberville.
Yes by proxy.
Senator Mullen.
Yes by proxy.
Senator Budd.
No by proxy.
Chairman Sanders.
Yes.
I have 18 ayes, 1 nay.
The ayes have it, and the amendment is agreed to. We'll now vote on Casey Amendment Number 2. Clerk will call the roll.
Senator Murray.
Aye.
Senator Casey. Senator Baldwin. Senator Murphy. Senator Kane. Senator Hassan. Senator Smith.
Aye by proxy.
Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
No.
Senator Paul.
No by proxy.
Senator Collins.
Yes by proxy.
Senator Murkowski.
Not voting.
Senator Braun. Senator Marshall. Senator Romney.
Not voting.
Senator Tuberville.
Aye by proxy. No, I'm sorry. Yeah, aye by proxy.
Senator Mullen.
No by proxy.
Senator Budd.
And no by proxy.
Chairman Sanders.
Aye.
I have 13 ayes, 6 nays.
The ayes have it, and the amendment is agreed to. I think we're up to Cassidy Amendment Number 1. Clerk will call the roll. Cassidy 1.
Senator Murray.
No.
Senator Casey. Senator Baldwin. Senator Murphy. Senator Kane. Senator Hassan. Senator Smith.
No by proxy.
Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
Yes.
Senator Paul.
No by proxy.
Senator Collins.
Yes by proxy.
Senator Murkowski.
Not voting.
Senator Braun. Senator Marshall. Senator Romney.
Yes.
By proxy.
Senator Tuberville,
Yes, by proxy.
Senator Mullen,
Yes, by proxy.
Senator Budd,
And that's a yes by proxy.
Chairman Sanders.
No.
I have 6 ayes, 14 nays.
The noes have it, and the amendment is not agreed to. We will now vote on final passage of S 2840 as amended. I move to favorably report S 2840 as amended. The clerk will call the roll.
Senator Murray.
Aye.
Senator Casey. Senator Baldwin. Senator Murphy. Senator Kane. Senator Hassan. Senator Smith.
Aye by proxy.
Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
No.
Senator Paul.
No by proxy.
Senator Collins.
No by proxy.
Senator Murkowski.
Yes by proxy.
Senator Braun. Senator Marshall. Senator Romney.
No by proxy.
Senator Tuberville.
No by proxy.
Senator Mullen.
No by proxy.
Senator Budd.
And that would be a no by proxy.
Chairman Sanders.
Aye.
I have 14 ayes, 7 nays.
The ayes have it, and the motion is agreed to. I now move to authorize staff to make any required technical and conforming changes when preparing S 2840. And the clerk will call the roll on that. Okay.
Senator Murray.
Aye by proxy.
Senator Casey. Senator Baldwin. Senator Murphy. Senator Kane. Senator Hassan. Senator Smith.
Aye by proxy.
Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
No.
Senator Paul.
Not voting.
Senator Collins.
Not voting.
Senator Murkowski.
Not voting.
Senator Braun. Senator Marshall. Senator Romney.
Not voting.
Senator Tuberville.
Not voting.
Senator Mullen.
Not voting.
Senator Budd.
Not voting.
Chairman Sanders.
Aye.
I have 13 ayes, 1 nay.
The ayes have it, and the motion is agreed to. I now move to authorize staff to make any required technical and conforming changes when preparing S 1573, S 2415, and S 1624. All those in favor, please say aye. Aye. Those opposed? The ayes have it, and the motion is agreed to. That concludes the votes, and I ask unanimous consent to enter into the record 12 letters of support for the Bipartisan Primary Care and Health Workforce Act. That is all our business today, and I thank everybody for their hard work on this. The committee is adjourned.